Primary care physicians are becoming extinct. It's true. It really is. Hello, I'm Dr. Schimpff, and this is part of our series on the crisis in primary care. Last time we talked about the root causes. Today I want to talk about the shortage of primary care physicians. If you look at primary care physicians right now, you see that the older ones are, whenever they can, retiring early. Those who will call them in mid-career, they're feeling just really pressured, really frustrated. They feel like they're in a production mode of medicine, have to see these patients every 15 minutes or so, and yet they still have the administrative issues of their office. So they're selling their practice to the local hospital and saying, at least I've gotten rid of the administrative burdens. Like now I just have to take care of my patients. And students aren't going into primary care anymore. In America today, about 30% of doctors are primary care physicians, 70% are specialists. Some decades ago, it was just the opposite. 70% primary care, 30% specialists. If you look at any other developed country, it's about 70% primary care, 30% specialists. So why has this switch occurred? Well, it has to do with the shortage and the fact that primary care is seen as not the specialty to go into anymore. There's about 210,000 primary care physicians in America today. It's estimated that by the year 2025, we'll need another 52,000. And that takes into account retirees on the one end, but also a growth in the population, an aging of the population, which makes a huge difference in needing more physicians, and also more people being insured. So all those together about 52,000. But that assumes we continue this practice of only 8 to 10 minutes per patient or a 15-minute visit. That's not enough. So you really need a lot more than 52,000. As I mentioned, primary care is just not seen as desirable anymore. Medical students are smart. They look at the situation and they say, gee, the doctors are frustrated. They're relatively low paid compared to specialists. Specialists earn on average about twice as much. And they're working really long hours. Why should I do that? I'll just become a specialist. So there's these pressures on all ends which is driving this shortage in primary care. It's not getting better. It is a real crisis. And next time I want to talk to you about the importance of this crisis and the importance of listening in medicine, but something that's not easy to do when there's a shortage and the doctor has so little time per patient.